This summer, during an 8-week period, 6 interns joined our team for a unique, hands-on, immersive internship experience that took place in 5 provinces in Ecuador. After a competitive selection process, 6 university students joined us in Ecuador for a summer, field-based community health development immersion. The program focused on sustainable community health development, healthcare systems in resource-conscious settings, intercultural collaboration and community engagement, research, leadership, and project management. The main focus of our trip was our cervical cancer screening project. This project was designed last year by an intern with mentorship from our international expert team. This summer, we had the opportunity to implement the project, showing true continuity of our work. Interns assisted our medical team from feeboospam to screen over 500 women via mobile medical clinics in 13 communities. Interns supported data collection, outreach, and follow-up. Interns developed individual projects that were inspired by focusing on combining intern talents, known and soon to be discovered, and their interests. Interns then worked with our leadership to assure that every project was aligned with real community needs. Projects addressed healthcare access and affordability, water-related illnesses, and the assessment of our program that supports young mothers. Other projects conducted statistical analyses of the cervical cancer screening program and conducted observational studies of our community health campaigns. During their time in country, the interns also supported the delivery of mobile medical care across rural areas, providing general medicine care, vision care, pediatric care, dental, and chiropractic support. Those campaigns provided crucial medical attention to over 800 people. Interns also supported a 4-day oculoplastic surgery campaign and a 3-day women's health campaign. They also contributed to statistical analyses that will guide future outreach efforts. This immersive initiative allowed interns to connect academic learning with real-world health systems. It was a truly transformative experience that combined knowledge with hands-on impact. They contributed to immediate care and long-term systems change, helped shape our strategic plans, and strengthened health equity in Ecuadorian communities. We are grateful to the interns, their families, our university partners, PACH contributors, the communities of Ecuador, and our partner feeboospam for making this immersion possible.